Hi there, my name is Tina Liu. I am doing my presentation on Kaiser Permanente in the US. My goal is to improve employee health by reducing prevalence of overweight and obesity risk factors. So the introduction to Kaiser, it was founded in 1945 by Henry J. Kaiser and Sidney R. Garfield. Its headquarters is in Oakland, California. It has 174,000 employees currently, and they work to provide high-quality personalized health care for patients. Kaiser is one of the nation's largest non-for-profit health plans in the U.S., operates in 8 states and D.C. It has 3 big branches, including the Kaiser Foundation hospitals, where physicians are responsible for medical decisions, Kaiser Foundation Health Plan, as well as Permanente medical groups, which provide care for Kaiser Permanente members. The product of this organization is that it's a healthcare provider that incorporates unique elements to providing medical needs, promoting preventive care, and overall wellness. A quick view of the United States of America. The population is 317 million people. Our life expectancy at birth is 76 in males and 81 in females. The main causes of deaths in America is cardiovascular disease, cancer, and other non-communicable diseases. Risk factors are shown below: smoking, alcohol, blood pressure, obesity. Smoking has decreased in the last number of years, but obesity remains a huge problem. The U.S. healthcare system has 2 main components. There's private, which includes HMOs, PPOs, and high deductible plans. In this case, Kaiser would go under the HMO private plan. For public health insurance, it's mostly funded by the government. The Department of Health and Human Services funds Medicare, Medicaid, CHIP, and also the Veterans Health Administration. Culture and mentality can play a big part in health belief of a certain country. In the US, there's something called a social and physical determinants of health that exists in the community. It means that there are a number of factors that contribute to a person's health status, which include socioeconomic status, environment, income, education, things like that. Those in racial and ethnic minorities are more likely to have higher morbidity rates, unfortunately. Other things about Americans: very individualistic. They see resources as available in abundance, especially in healthcare. Concerned about privacy, really. Access to healthcare depends on ability to cover for costs, which is essentially health insurance. To communicate with Kaiser, it would be more effective to contact the human resources or media relations for the targeted facility or region that you want to implement the program in. You should just introduce yourself and state what company you're working for, what kind of health promotion plan that you want to implement, and say your goal, which is to monitor and evaluate current employee health conditions and use the feedback to improve existing health promotion programs at Kaiser. So what is the importance of health promotion programs? Health promotion programs are really essential to improve employee wellness and health. Employees who are in better health and wellness are more likely to stay with their organization, and they're more likely to be engaged with their work. This in turn would lead to maximum productivity for the business, as well as reduce medical expenditures for health conditions. The benefits for Kaiser Permanente would be the return on investment from workplace health initiatives and the implementing of a culture of wellness and health in employees. There also would be lower medical costs, as mentioned earlier, also high productivity, also lower absenteeism in employees, because since they're less sick, they would go to work more often, and also promote a positive work environment. Some employee benefits would include the ability for employees to provide input of what they want to do for health activities in the program. Their solutions are personalized to each individual's needs. their increased mental, physical, and emotional wellness, change of lifestyle for the better, and also cash or reward incentives for completing the program. So Kaiser already has a workplace wellness program. It's called Live Well, Be Well. It was implemented in Northern California and covered 68,000 employees and 7,000 physicians. Kaiser was named the healthiest employer among the large Bay Area companies in the newspapers. The program covered 6 major categories, which is listed on the slide. There was 250 services aiming to promote and enhance health and the well-being of employees as well as physicians. These included preventive screenings, wellness coaching, walking, running programs, as well as health classes. As seen from the health statistics of the US, there's over a third of the US population of adults that are obese, which is a really big problem. It's strongly related to chronic health problems and increased healthcare costs. There's cardiovascular diseases, which again result in 31% of deaths in the US. This can be due to occupational work, related factors, including working overtime, stressful environment, physical inactivities, things like that. So with this obesity problem in 2008, there was an estimated annual medical cost of $147 billion. So that's a lot of money. And that really accounts to $1,429 higher for obese individuals than when compared to those of normal weight. So the ultimate goal of the program would be to reduce the amount of overweight and obese individuals in the workplace, which would lead to less medical expenditures. Some sample questions from the weight management program would be: how many times do you exercise a week, as well as how long are your workout sessions on average, because this can really tie into how much physical activity a person is doing and how, if they can change that, they can also lose weight. So this program will be called Weight Management Program for Kaiser employees. It's an all-inclusive program for employees and physicians, which would include health screenings, biometric screenings, which would include cholesterol, BMI, and blood pressure ratings, screenings, nutrition, consultation, health coaching, personalized meal plans, healthy food choices at the workplace, work breaks for physical activities, things like that. There's a big emphasis on weight management and weight loss in this program, especially for those in the BMI ranges that would conclude as overweight or obese. The program could provide cash or reward incentives for completing the goals at the end of the year, which could be a paycheck bonus or a physical reward. Moving on to the evaluation of the program, there would be surveys to assess employee satisfaction, as well as feedback reports of their health conditions before and after the program. There would be monitoring of how many people pick healthy food choices, and also the physical activities that they do during breaks. There would be an analyzation of worker participation in the program, as well as a biannual health screening for checkup of health progress. So the expected results of this program would be reduced rates of overweight and obese individuals. It will be measured by measuring a person's BMI, blood pressure, and cholesterol, as stated earlier. To report to the CEO or HR, there would be data analysis depicted visually, as in like bar and line graphs and such like that, and also a comprehensive report of the before and after health conditions of workers. There would be a follow-up on a long-term basis with the company as well, to make sure that the employees are keeping up with this lifestyle change. Some future recommendations, really through diligent implementation, monitoring, assessment of public health, workplace promotion programs can really improve employee wellness and health. Kaiser can definitely help its employees attain better health, to provide more productivity, incur less medical costs, and reduce absenteeism due to health conditions. Rates of overweight and or obese individuals in the workplace will most definitely decrease if a health promotion program like this is implemented. So upon the program's success, there could be further expansion of the same program to other facilities or targeted areas or regions like that, especially in at-risk populations. Employees really must have the willpower and commitment to actively engage in these programs to really be successful in achieving their health. So this is the end of my presentation on Kaiser Permanente and my implementation of the health promotion program. I hope you enjoyed my presentation, and if you have any questions, please let me know. Thank you.